Hello friends, let's today talk about anterior versus posterior approach for hip replacement surgery. This is a very debatable topic because it is an approach that your surgeon will take to reach your hip joint during your surgery. Normally both the approaches have their respective advantages and disadvantages, and it depends on your surgeon's training and his choice what kind of approach he is comfortable in. But let's discuss what are the respective advantages and disadvantages of both of them. Normally the anterior approach is from the front of the hip, and the posterior approach stands for the approach that is from the back side of your hip. Overall, the surgery is going to be the same. The implant placement is going to be the same. They are just different routes to reach to your hip joint. Please note, there is no clear consensus which one is better, but there are advantages and disadvantages linked to both of them. So when we talk about the posterior approach, please remember it is one of the most commonly used approach worldwide. Advantage is you get a very good exposure of the entire hip joint, so that makes the field of vision very good. It is easier for placing your implants in proper position. Basically, if you get a good view, you can place the implants in a better position. So less chances of malpositioning of implants by this approach. Thirdly, it is very good for revision cases or complex cases because you need good exposure when you are doing a revision case or a primary case with complex deformity. Disadvantages of posterior approaches: dislocation rates are little higher as compared to anterior approach. Also, the restrictions like deep bending or sitting cross-legged or twisting your leg for the first few weeks at least, we advise patients not to do these activities because the dislocation rates are higher with posterior approach if we try to do these things. But please remember, posterior approach is used worldwide. It is the most common approach and results are good in the hands of a good experienced surgeon. Now when we talk about the anterior approach, this is more or less as we call a muscle sparring technique, and the exposure is through the front of the hip joint. Here we spread the muscles, we do not cut them. So faster initial recovery is there. As a result, pain is less. Hospital stays in majority of the cases less as compared to the posterior approach patients. Also, it has a low inherited risk of dislocation. So as a result, precautions like using a low floor chair or squatting or sitting cross legs are also less. But there are few disadvantages also because it is a more technically demanding procedure. It requires special equipments. It is not suitable for very obese patients or patients with complex hip anatomy. And it has higher chances of temporary numbness in the thigh because of nerve stretching, or this approach is little closer to the artery as compared to the posterior approach. So overall, both the approaches are good. It depends on your surgeon's training and his expertise which kind of approach he wants to use during your surgery. As long as there are no dislocations, there is hardly to choose between walking, climbing stairs, or resuming your activities like bending your knee or sitting cross-legged or driving car or cycling or swimming. So both the approaches are good. In posterior approach, it is good in cases where there is complex anatomy and we want a better exposure. Anterior approach offers faster recovery, less dislocation rate. So discuss these options with your surgeon, but ultimately leave the choice with him because he is the one who is going to do the surgery, and if he is trained in a particular type of approach, he can give you best result by that particular approach only. Thank you.